Elliott. I'm with the Parkinson's Foundation, already elegantly introduced by my colleague Ronnie. I think if I could just suggest, we have a few minutes for these questions, and I think if we can do it pretty much the same way we did this morning, beginning with some interaction among the panelists, and maybe an initial question by me, and then if the organizers will allow us a few minutes beyond 3:50, we would certainly want to exchange with our community in the room. I was very struck in hearing this, that this was in very different ways. Our panelists were talking about professionalizing the professions in Parkinson's. And each one of them spoke either in enriching community educators, that Deirdre talked about, in enriching the preparation of nurses, which Gwen talked about, enriching the preparation and deployment of research advocates, which Ronnie talked about, and then finally, even doctors themselves through the Buddies program and use of working with medical schools. As a group, I found that really much more harmonious and really fascinating than I had thought first looking at the program. It really hung together in a very good way. So, I would like to ask our panel a question for those who wish to answer it. If you were to imagine dreaming about even further professionalizing the professions, could be in increasing the numbers, it could be in increasing the kinds of skills you're transmitting through the training, or it could even be by adding new professions, such as social workers or physical therapists. We're already doing some of that at PDF, or other professions. Are there any of those ways that you would see in your dreams taking your programs even further than you have today? Gwen.
To say, I have a lot of dreams, first off, but I think that our model has proven itself. We now are working with the Parkinson's Disease Foundation to establish a physical therapy program for physical therapy educators, and had the first program in Boston this summer. So I think models work, and they're adjusted depending on the group that you're talking about, but there's something that we can all share in that way.
Anyone else? Ronnie?
I think, for me, because of the representing the patient engagement component, it's the common thread. Because I know with Gwen, we've had research advocates that have spoken, and that with your program and with yours, that there's people with Parkinson's. And I think that's a piece to remember, that in every single program, there always should be an intersection. And the other piece is I would call to question the use of the word professionalizing things, and is that what our goal is? Is it really like deprofessionalizing or leveling or focusing on collaboration? It's not looking at, this is the epitome of what we all want to be. It's respecting everyone's differences and having them share.
Interesting. We'll talk about that later for some hours. It's certainly a very good refinement, which I certainly accept.
Hopefully I'll still have a job after that comment.
I think we're very fortunate with our program in New Zealand that we are seen as sector leaders in Parkinson's, so other organisations like Alzheimer's and stroke, etc., are trying to copy our program now and are asking for our advice. So I don't think I would change so much our program. I would, in my dreams though, would have systematic engagement across the country with the health services. So not just based on the favoritism of some neurologists and not others about whether we're in the room or not. So that would be my dream, I guess, to be in every multidisciplinary team, not just in some of them.
Fine dream. Thank you.
And I think for us it would be, it's not even a far-fetched dream, but just finding a way to incorporate a lot of the already existing programs. For instance, I've just expanded into an area 2 hours away from our initial kind of service area that doesn't have any movement disorder specialists. And one of the big questions is, we know that there's no interest. We're not large enough for movement disorder specialists. And so, I see this nursing program, and we can definitely find better ways to incorporate programs that are already existing. We just have to educate ourselves about them.
Right.
Any questions you'd like to ask each other before we open it up to our friends in the audience? Any particular thing that you thought was... Gwen again.
I would like to ask about the buddy program, because I just, knowing some of the relationships the nurses that I work with form with the patients, what do the students do at the end of the year? They and the patients must be heartbroken to say goodbye to each other.
But they don't have to say goodbye.
Okay.
And that's the thing. We don't give any expectations of what type of relationship. Mm-hmm. Some are probably happy to say goodbye, but I know others. I know of others who have gone to weddings this summer because the med student got married, and or somebody had a granddaughter had a birthday, and the med student and the girlfriend was invited. Mm-hmm. So they truly can decide what type of relationship to have. So it's they don't have to say goodbye.
It's wonderful.
Okay. Any other questions you have? Okay, questions from our friends in the audience. Do I see any upturned hands? Yes, Dr. Brunner. You may need a microphone. Somebody will race to your assistance.
Yeah, this is a question for Ronnie from the Parkinson's Disease Foundation. I was really impressed with that presentation, and particularly the aspect of support for training leaders and leadership programs. My question is, in addition to training for skills and different proposals that come forward, from what I saw, it's restricted to the United States of America. Would you at any point of time be looking at supporting good programs with both funding and expertise in underserved populations out of the United States of America?
I think that's an excellent question, and I think one of the reasons why we're all here at this leadership forum is that when I came in this morning, I was hoping that would be a dialogue that would be able to that would come out of something like this, that we could have some conversations. I know that there are other, we have a program in the U.S., but there are other programs around the country. I know Parkinson's UK is here, and they have a patient engagement initiative, and there are others. And so I would like to put a charge out to those of you that are interested in looking at patient engagement on a global level, that maybe we just huddle after this in the corner and start talking about things like that. So.
Thank you. Any other questions? I think we'll be through. It's a great session. Thank you all of you for coming. If you've any suggestions, I know we have a formal process in the Congress for taking comments, how things can be made better. And those of you here, particularly those for the first time, if you'd care to share these with us informally or formally, we'd love to know how we can make this even better. I think this is my 4th leadership day, though it hasn't always had quite that special designation. But it's certainly, in my view, the best, and it's made that way by the terrific program that was designed, terrific panelists who've consented to lead us, but also by everybody else who joined us and made the thing a very fine professional experience. So I use the word, since Ronnie and I had a discussion of this, I use that word in the highest possible spiritual sense. I hope you realize that I'm doing that. Thank you, everybody. Enjoy the rest of your day and the rest of your program at the conference.